Or message to the song. Liberia will rise again. Okay, then so let's just bring this song down. This is the final one done by LIB international artist Sam Achivon, and he calls it Rise Again. Let's now welcome 50-50 right here.
Good morning, Monrovia. Good morning, Habel. Good morning, Robertsfield. Good morning, Robertsport. Good morning, Toyota. Good morning, Salala. Good morning, Macaque City. Good morning, Tottenberg. Good morning, Clay. Good morning, Bo Waterside. Good morning, Riverside. Good morning, Bapulu. Good morning, Buchanan. Good morning, Lac. Good morning, Caldwell. Good morning, Brewerville. Virginia and Camp David. My river air, this is 50-50 on a Wednesday morning, midweek, Wednesday morning on Sky 107.1 FM. Well, we should have had our special studio guest on Monday because of he will tell you the reason why he didn't show up, but he wants to make it good and make it honorable. He talked to us and said, look, I have my views as to why we should proffer that will be an effective game plan in the fight against Delta variant, which is the third wave, and America has put Liberia on level 4 of the Delta wave. My name is Steve Max, and by 11 o'clock, the lines will be open 077777107. You'll be live from 50-50 on Sky 107, or you can call us on 07772212223. Those same numbers are applicable on all our Facebook and social media platforms. Our special studio guest is Universal Liberia Professor Thomas Kaydor. We'll be back right after the theme song.
Anybody who know I get money for them in the market here, please come closer to me with your food so I can send you quick cash. I'm too big to be holding people.
Bagu, you strong because the money you owe me is full of bucket. Anyway, we don't get any problem with you as long as you will add something to pay for the charges.
I got a surprise for you, Manpo.
Enjoy more than a month long of Orange Money transactions free of charge. Yes, perform these Orange Money services. Send money and buy goods and services free of charge. I mean, no fees attached. Don't just stand there. Dial *144# now. It's all about what matters to you. Orange.
Bring my umbrella so I can rush to the bank before the line gets long.
So the bank? Under this ring? Let me laugh at you small, yeah? Yeah, big girls like me do banking from anywhere. All I need is a nice cup of coffee and a chair. It's time to start transferring some cash around.
Oh, you can transfer money from your bank account to your phone?
Simple. My account is connected to my wallet. Standing in line at banks is the least of my worry these days.
Orange Money Bank to Wallet is now with EcoBank. Transfer your money from the bank to your Orange Money wallet and vice versa. Register today with Orange Money Bank to Wallet and worry no more about standing in long queues at the bank. Now you can do your bank transfers from anywhere using your phone. Just dial *144# and follow instructions.
Brings you closer to what matters.
Orange.
Hey man, give me the answer now. What's the now president of Liberia Football Association?
Oh my brother, why you saying I'm gonna give me that for? You asking me play that class?
But yeah, I'm a new level, yeah. The more you know, Orange, it's the more you win.
Predict the exact score for each Euro Cup 2020 game and stand a chance to win recharge cards and cash prizes up to $50. Text your answer to 272. Each text is 10 cents.
Brings you closer to what matters.
Orange.
Papa, I just like enough on the president when I saw.
You can't play, my biggie. You know you're the news?
Why news again?
Get your Orange Home Internet bundle for only $39. That's 75 gigabytes of data for 30 whole days for only $39. Just dial *833# to activate your Orange Home Internet bundle.
Brings you closer to what matters.
Orange.
Papa, I just like enough on the president when I saw.
You can't play, my biggie. You know you're the news?
Why news again?
Boost your data allowance with the new Euro 2020 Cup Data Bundle. Get 1 gigabyte for $1 only. Valid for 24 hours. Just dial *111#.
Brings you closer to what matters.
Orange.
Hello, your number one 100% Liberian-owned professional garage and auto parts dealer, Uptown Garage, is still around and going stronger and getting better. Yes, Uptown Garage at the intersection of Broad and Nelson Streets, after 20 years in the business, has a new spare parts store known as Uptown Spare Parts on Broad Street side. You don't have to order spare parts from overseas. You can purchase brand new spare parts for your car from us. No more used parts. For original spark plug from Japan, oil filters, engine oil, and everything you need to get your car working perfectly, come to us. Uptown Garage has a branch at Rehab that you can also count on. We have a diagnoser that can find and we fix any problem on your car. With our sophisticated equipment, we give 1 month warranty. We provide a tow truck free of charge if it's our garage that will work on your car, or we can tow your car anywhere for a fee. Uptown Garage has been around for 20 years now, providing reliable, efficient, and professional services and durable auto parts for your car. Contact Uptown Garage head office on 0777 553317, 0886 553317, or at our rehab branch on 0770 90. Address is Uptown Garage 2014. Come, Uptown Garage, always the best.
Thank you very much. You're back on 50-50 on Sky 107. What will you prefer as an effective game plan in the fight against Delta variant, which is the third wave of COVID-19? The Americans, CDC put it for Liberia as the level 4 of the COVID-19. What do you prefer, a total lockdown along with the deployment of AFS soldiers to enforce the compliance of all the health protocols, or a partial lockdown with all the health protocols observed and go about our normal businesses? If your answer is A or B, give me your reason. Our special studio guest is Thomas Kaydor. Before we get to that, let me give you the banner headlines of the two newspaper front and back pages. Let's start with Philip Wisse's newspaper. Matter of fact, I will talk to Philip Wisse today. Some of those crazy things that happened to me in 2005 when I was hospitalized. Like the same news that been going around. I talk to Philip every day, but you will hear him live from Accra, Ghana today. Let me read it. Let me start with his paper to know that he's staying around here. Let me read his paper so that you know Ginan's paper. The banner headlines on the front page says, "Conduct all funerals at funeral homes." There's a quote from the incident management system mandates as U.S. government alerts travelers to Liberia. All funerals must be conducted at funeral homes. From there straight to the graveyard, it should not be more than 30 sympathizers. That's why they say, "Give us back our money." Fagon Fries, Ben Savi, Fagon, the photos are here along with the with the protocol enforcement, the Minister of Health and Social Welfare. Calando lawyers demand US 1 million from GT Bank. BWI needs a technical college status. The back page of Louisiana's newspaper says Watch Commission driver arrested with firearm as Basel police enforce COVID-19 protocols. Senate confirms Jalawal Temple as deputy minister, replacing far gone. He's far gone from Liberia. He's far gone from Liberia. The front page of the front page newspaper says, relieve him of his duties. Relieve him of his duties. Minister of Justice Rice Senate President pro tempore to temporarily take Secretary of the Senate J. Nambolo F. Singbe off the job due to the ongoing economic sabotage, theft of property, forgery, and criminal conspiracy trial. No need for lockdown yet, health minister that shows Senate despite increase in the number of daily infections of COVID. She's saying no lockdown yet. I just don't know how many persons must die first before we find the need to comply. In Sierra Leone has reinstated the state of emergency for 3 months, brought curfew back for 3 months. Our minister is saying to us, not yet. In other words, you're telling me, no, not too many people die yet. No, we reached that, not yet. We're not locking down yet. The number of deaths has not reached to that level for us to lock down. Not yet. That's what the Minister of Health is saying. Tape turns over brand new Jeep to District 8 representative Akarios Gray for onward presentation to the organizer of Miss District 8 beauty pageant. My man, beauty pageant, we're not after beauty pageant now. COVID, Delta variant is killing people. We're talking about beauty pageant. No time for that. Apologetic Drug Enforcement Agency Commander Masale, is how she's called, Masale, rushed out of session due to high blood pressure during legislative inquest. The pressure rise to the point that her blood went up, or pressure went up. If had she stayed longer, she would have died. And she said in a quote, I am sorry. I was giving a scenario to the students, something that happened as far back as in the previous administration. It has nothing to do with the 54 legislature. I was giving a scenario to the students to make them to understand what I was saying. So I'm again appealing to this honorable body for the ugly message that was captured by the front page African newspaper. And I extend my sincere apology, as we all are humans and we all can err. You know the story, your old man. I know the story. Before you went there, they call you, your family people call you, say, but will call you, tell them you sorry. Tell them you sorry. So, and the question your pressure went up. The logical thing to do is, I beg you, I'm sorry. The thing I say, that devil fool me or that slip of tongue. You know the facts. As continuing the paper, then you went to them because you were afraid of containment. You go to Sabi, you say, I'm sorry. That's what she said. Coronavirus infection on the rise, causing big rush for vaccination, but Liberia is running out of COVID-19 vaccine. It says, I'm quoting Chester Smith, Director of Communication Incident Management System. He said, and I quote, we have vaccines in the country, but on a very low scale. So what we're doing is that the vaccines that were sent to various counties for immunization are being brought back to Masurado County, which is the epicenter and has the highest number of confirmed cases. We are expecting vaccine in the country next week. You're killing me with this, Professor. You're killing me. The vaccine that was sent to the other counties, bring them back. Your one that can die now until next week when we get something. This is crazy. This is crazy strategy. In Grand Crew, where I come from, you're telling me people in Grand Crew, in Basson, in the other area, you're still there. You're worried about your vaccine, your COVID variant. Monrovia is the epicenter. Let's save lives in Monrovia. Lost lives outside Monrovia, Masurado County. The back page of the front page newspaper It's an announcement from the Inquirer news, from the front page newspaper said the death announcement that is to announce the sudden and unexpected death of Mistress Jeanette Kafai Bacon of STD Boulevard, Concord Town, Liberia. Miss Janet Bacon was a graduate of La Curie Mission, Breville, Monserrato County, and the Firestone School of Nurses, where she became a registered nurse. Janet worked at the Dusa Hospital in Division 10 Firestone, the Cali Hospital in Monrovia, and the Lamco Hospitals in Buchanan, Basso County. She worked for Lamco for many years until the Civil War erupted. We are saddened by our unexpected passing. Nobody passing is expected anyway. Nobody passing is expected anyway. But the family said we are saddened by the unexpected passing. Sister Gina is survived by our 2 children, Munan Pennon and our other son, Mr. Harry T. Pennon, and 2 other sons she helped to raise, Mr. Gerald Pennon and Mr. Charles Mondiga. That's going to be a bastard name, Mondiga Deeks, her daughter Tibe Bacon, predeceased. Funeral service and funeral arrangements and the memorial service date will be announced later. Who signed this? Kadi signed this. You can buy the 2 newspapers, and our today choice is almost the same, the similarities. Philip Wisher editorial put there, welcoming the enforced march wearing front page is saying it is time to roll off our sleeves in COVID-19 fight. Liberia is on the brink of a disaster. I'm taking this front page editorial as my preference for that. Let's get back to what we're here for. We have invited the man who didn't show up. He's here for with us. Is a professor at the University of Liberia, Thomas Kaydor. Good morning, Prof.
Good morning, T. Max. Good morning. So first, let me say thank you for inviting us on the show. And second, I would like to say sorry and apologize to you and your team and all the listeners and viewers of your program 50/50. I agreed on Sunday that I was coming here on Monday so that we'll have this discussion. Interestingly, your show is 10:30. So a former student of mine who is also running a morning show, Oscar Morba from 2FM, said, but Prof, we can take you by 8 to 9. So I said, well, from 9 to 10:30, 1 hour 30 minutes, I can make it.
So you thought?
I thought. So I went on the 2FM. And so after the show at 2FM, I got on my way. I was in a huge traffic and could not catch up with the time on this particular radio. So I was in that traffic when I sent you that text message. I'm sorry, I'm not making it.
I didn't see the text message.
Oh, so
I didn't see it.
So I want to tell the listeners and viewers, I'm very sorry about that, my failure to appear. And I think next time, it's a lesson that our roads are just bad off now. There are no traffic lights, the police are there. People are running opposite lanes.
And legislators are taking the third lane.
You know, so it's really embarrassing. Well, I hope we can fix that sometime soon because it's not a good sign.
Apology granted. Thank you very much. What would you prefer as an effective game plan in fighting COVID Delta variant, which is the 3rd wave? The Americans have actually put it at level 4 for Liberia. At 4, the Sisterly Republic of Sierra Leone has reinstated the state of emergency for 90 days, which is 3 months, reinstituted curfew. The incident management system said this time there'll be no funeral in churches. There'll be the funeral will be conducted at funeral homes, and not more than 20 sympathizers will be. Yet, we have not reached a total lockdown yet. The minister said we have not reached there yet. Meaning we will get there, but she said we have not reached there yet. We should get there first. That's the meaning of the phraseology. We have not reached there yet. Meaning we will get there, but not time for us to lock down. So why would you prefer a total lockdown, along with the deployment of AFL that was done in 1 and 2, or COVID level 1 and 2, or do you prefer a partial lockdown?
Actually, I think I go for the first option, which is that the government should lock the country down, mainly Monserrato County. And the reason is simple. There's evidence that because as a teacher, I like to use evidence. So I listened to Dr. Kete
Yes.
on ELBC. And amongst things he said, one key thing was that, look, the major hospitals are failed. And we don't have the oxygen tanks in sufficient numbers. So we're trying to get some from Cote d'Ivoire, where we understand they are some. So we want to buy some from Cote d'Ivoire. And we're asking citizens in Liberia, if you have such tanks, we want you to donate because the hospitals are filled. On ELBC, the lady there gave that interview. I think that was sometime last week. And then it was very clear that, so if you're sick, don't go to the hospitals that are already packed now.
Stay home.
Stay home and call.
Stay home and call, and how will you get treated?
That's one thing. Okay. So then I also listened to Dr. Brown from the head of this fight. And he said, look, it's not that we don't want people to come to the hospital. But the point is that
we don't have the space.
We don't have the space. We don't have the space. So the best thing is that if you are sick, stay home so that, and you make contact, you call. My concern is the first thing any medical person should be telling any human being.
When you say go to the hospital.
When you say go to the hospital.
When you tell me stay home, it means that we are on the brink.
Then there is a problem.
There is a serious problem.
There is a failure system.
Doctors telling you when you say don't go to the hospital, stay home.
Yeah, stay home and call. We'll be treating people at home. Where can you treat people at home in this country? People are sick, they're home. How will you treat them now? Okay, I even need the contact number that I need to call. Because myself, I want to do checkup. Even though I took my vaccine, I'm wearing masks, I walk with my alcohol and all this. But the point is not, so when people are sick, they need to go to the hospital. Because it is the hospital that will examine
and prescribe
medicine. Without the medical system, practitioners are saying, don't just go and buy drugs, right? So if I don't go to the hospital, what do you expect me to do when I'm sick? So you see some of the pharmacies and drugstores are just
become astronomical now.
Things for themselves to go and say, everybody want me will help me. So this is just a wrong message. And so the communication strategy for this whole fight is not in place yet, in my mind. Another key evidence is, you were reading the papers, in fact, you talk about it. The U.S. government, MSA, has indicated travel advisory to Liberia. There are 4 levels that the U.S. government uses. So you got level 1, which is saying exercise normal precautions. Level 2, exercise increased caution. Level 3, reconsider travel. Level 4, do not travel.
Straight. Do not travel. It's a fighting.
This is what the U.S. government has said. So imagine, let me just read this short paragraph. The Center for Disease Control and Prevention has issued a level 4 travel health notice for Liberia due to COVID-19, indicating a very high level of COVID-19 in the country. Very high level, that's what they say. Your risk of contracting COVID-19 and developing severe symptoms may be lower if you are fully vaccinated with an FDA-authorized vaccine. Before planning any international travel, please review the CDC specific recommendation for vaccinated and unvaccinated travelers. Visit the embassy, COVID page, blah, blah, blah. Do not travel to Liberia due to COVID-19. Exercise increased caution due to crime. They also indicated there's crime in Liberia. So they say violent crimes such as armed robbery is common, particularly in urban areas and on public beaches. Local police lack the resources to respond effectively to serious crime.
That's nailed the casket.
This
is nailed the casket.
This is what the American
Liberia has become a no-go zone.
No-go zone. So what are you waiting for?
If you come, you were contracted.
What are you waiting for?
If you come, you will be robbed.
They need a lockdown. They need to lock down. I shouldn't even be here. If I want to appear on the show, I should call in. Call on the phone. We should be locked down because this is very serious. If the U.S. government says this about Liberia, and the president sits down in France. What better can you get from France compared to America? We're talking about vaccines. We need vaccines.
Maybe he's going to get the vaccine.
You don't need to go to France. You don't have to travel to France. You can sit right in the mansion and make your contacts and push. If CDC representation is here, the same center that issued the statement, they got representation here. I met the lady who I think is the head. Interestingly, she's married to a Liberian. She's married to Dr. Ali, who was the vice president for academic affairs at the university. I met the lady, the CDC lady, at Dr. Taylor's birthday some time ago, early June, around the 5th or so. So you can stay here and interact with the health authorities. These kinds of messages coming out of the health system, they tell you that the system has failed. This is the reality. So I'm not a health practitioner, but such messages coming from the health system tell you that we are on our own. So this is the time for the government to take lead. This is the time to say, look, whether you have to consult the national legislature based on the constitutional implication that, okay, if you put curfew or you put lockdown, people's rights are limited, so you need state of the emergency, put in all those modalities and see how the government as a whole can come together and say, look, this is our decision. We're locking down. We have to deal with this situation. What we reach now, America feeling telling that people don't come. So the businesses we're waiting for to come. Even the flights that are coming, all the people who are not coming from America, but they're coming from Europe, wherever. When they read this, they say, we can't go there. America, that is like the father to that country, is telling you the place is not safe. 2 reasons: COVID, crimes. So what are we waiting for? And you read in that paper, the minister says it's not time. So what time?
When a lot of the number of deaths has not reached yet to necessitate or to the lockdown. That's what she's telling you when you use that conjunction yet.
You know, it sounds crazy to me when people talk about numbers. No Liberian should die of COVID. No. That's why you were reading about the representative there who was having beauty party and whatever. Imagine he was writing on his page, only 120 people government say that, so that the number will go. You want 120 people to die? That's what you want? That's why you like? Somebody who is representing people says, government official statistics says 120 people died. All the other numbers people lying on. Do you want 120 people? Are you happy about that? You should not be happy about that. These are the people who are representing us.
They're not important lives.
So I think if the president is not in the country in the first place, I think they say Minister Tua is the one coordinating the cabinet in consultation with the vice president. So they have to take a decision. Because
neighboring Sierra Leone.
It should not be do you want us to die before you know that it is important and serious? We took the vaccine, but we are at risk if more people don't take it.
What I want to emphasize, I was talking to a friend of mine yesterday. He's in government. I don't want to call him because they might post something to his job. And we're discussing this scenario. What do we do? And he and I came to the conclusion in the protocol's observation that 3 major things we need to do. And those 3 major things must be enforced. Must be enforced. In order to have them enforced, we have to have a total lockdown.
Oh, yeah.
You got to make sure that you are vaccinated. All the misunderstanding and misinformation about the vaccine must go away. Make sure you are vaccinated. 2, make sure that we wear your mask. Now wear the mask under your chin.
No, it's not
wear the mask over the nose.
To close your nose and your mouth.
Yes, wear the mask. 3, keep the social distancing. The minister again, I don't know what she's thinking about. When we are level 1 and 2, she told us, keep 6 feet.
Yeah.
At level 4, she's telling me, keep 3 feet.
That's why I disagree.
I just don't understand it. So my recommendation to you, please get vaccinated. Do whatever you can do. If you have to pay for it, get vaccinated. 2, wear your mask once a day. Change it every day. If that's a cloth mask, wash it overnight, wear it. Do not wear it when you are in the car and the car is air conditioned. This is a new story. If you are by yourself, when you go home, you don't need to put it, but when you get in among people, you wear it. So there are 3 things: keep that distance, don't rob, keep it 6 feet. I recommend. I'm not a doctor, but I believe in the science. Keep 6 feet, wear your mask, get vaccinated, and keep that social distancing. That way, when the minister said we are not reached the point yet, she's talking about numbers. You are not dying yet to the number that will necessitate the decision to close, to lock down. That's what she's telling you. She said, and I will read that again. It's so annoying. And she said, we have not reached that number yet that will necessitate the complete knockdown. That's what she said. I just don't understand it. That's what she said. We have not reached that level yet for us to have a total lockdown. So just go on dying. Just go on dying until we reach. Maybe the minister in your hair has a number. If we reach to 500% dying, maybe she might consider a total lockdown. And I will say this: President Weah is not a doctor. He's not a scientist. There is the only time politicians will listen to the doctors and the scientists.
That is the point.
If you tell him, President Weah, this is getting alarming, we need to lock down, he won't listen. But when the minister is telling me, hey,
it's not time yet.
It's not time yet. The number we think is supposed to die, I'm not dying yet. Let be business as usual. Let them die until we reach to 500. That's what we see reason to lock down. I'm appalled with this.
And what is the role of MPhil in all this? This MPhil that is supposed to be disease control zone, what is their role in all this whole planning, management, and containment of the virus? This matter is very serious. This is not the minister's only job. The minister should be part of the medical response network, but this is not something that minister has to decide and say, this is what I want, and if I see fit, then government can act. This is about the safety of the state, the people of the country. So I saw her taking the vaccine, good. What they need to do now is to reinforce all efforts. If they are doing anything about it, they have to improve and even hasten that effort to ensure that they get vaccines in country. Look, the money they say they were spending on food and all these things, T-Mac, this is the time to spend money for your people. This is the time. This is the time for the lawmakers to even see reason that look.
You know, when I look at this,
if the president is
when
not,
I look at this
if the president is not making this decision,
on page 6,
unfortunately he's not in country. So the lawmakers also need to take a decision about what to do.
Forget about the lawmakers. They're making money. Let's forget about the lawmakers. They're making money. Some lawmakers are out. Forget about the lawmakers. If you cannot rely on lawmakers, be dead. The minister is telling me. Let me put on my
I agree with you.
The minister is telling me. The minister is telling me no need. She speaks softly, so I would think that she's a good Sunday school teacher. No need for lockdown yet. Health minister assures the Senate, despite increase in the number of daily infection of COVID-19 in the country. No need yet.
So
she just talked to the senators.
That's what I'm saying.
To the legislature. So then you say go to the legislature. Legislature will tell you the logical excuse. The scientists have told me a lot of people have not died yet.
So they are the politicians, and the politicians depend on the people. The numbers they need are the people to vote them, right?
Man, I'm not talking about numbers.
No,
the people pay money the other day. $30,000 each. You're talking about the people that leave. How much of that did you get? Did you get your stimulus in level 1 and level 2? Forget about that.
I quite agree with you, but I cannot overlook that because they invited this health minister to go and speak. Now she says it's not time yet. In their own mind, don't they see? Don't they read? Don't they listen to the doctors what they're saying? If the people you represent, if the people you represent, Dr. Brown, who is Dr. Brown? Is he not a scientist? If he tells you hospitals have failed, so people from your constituency or district or your county should don't come to the hospital when they're sick, you know what that means? That means stay home and die. That's the
But the
indictment.
number has not reached to that proportion that
So
would
they have
necessitate the
minister. People should stop playing around the lives of people here. This is a serious thing we're talking about. Those who were here helping us with Ebola, that we overcame, and even Liberia got good name that we successfully handle Ebola, and we have best practices and all of that. Why can't these people use the same best practices that we have to now come during Ebola when they had lockdown? Anybody could say it's not time yet. Could anybody say it's not time yet?
And
Some of the medical persons are dying
the
too.
infection transmissibility was lower then than what it is level 4.
Yeah. So
and the minister is saying no need yet.
So there's
No
a
need
need.
yet.
There's a need. I disagree with her. There's a need. There's a need because you have the evidence. CDC, the US CDC is telling you that we are at level 4. Don't go to Liberia. Don't travel there. If you go there, the likelihood of getting this virus is very high. They didn't say low or high. They say very high. So we have to be very careful. And the unfortunate thing, I keep saying this, President George Weah should cut short his trip to France, wherever he is. His advisor should tell him, this is not a good thing. You and myself, you come from Grand Cru, I come from Grand Cru. This man is our man from Grand Cru.
I'm not here for Grand Cru
No,
politics.
I'm telling you.
No. I'm not here for Grand Cru politics. I'm not here for Grand Cru politics. I'm interested in saying I will take all the vaccine from Grand Cru, from Riverdale, from Bapolu,
That's bad.
and bring it to Monrovia
That's
because there's the
bad.
epicenter.
Because
I disagree with the minister saying we're not locking down because a lot of people have not died yet.
T-Max, the data shows that all the counties have had deaths.
Mm-hmm.
If you look at the Enfield data, it shows the counties, and Mozzarella is higher, but all the counties have
It has not reached to the proportion that would necessitate
so the point is,
lockdown.
you cannot even say that bring the vaccine from Grand Cru or Riverside or Sino or Lofa so that people in Monrovia can take it. One of the key issues is that some people are doubting this vaccine. It is the job of the health authorities and the government to show leadership and build confidence in the population so that they can take the vaccine. So there are two things here. Vaccine came, some of us took it. Some people say they're not taking it. Whose responsibility it is to tell the people or convince them to take the vaccine? It's the government. Has the government taken leadership? Have you seen the president taking the vaccine?
President said not taking it.
That's what he said?
The president will not take it. The president has not taken it yet.
So who shows that look? For our
Dr. Francis Capet took it. I saw that. Ellen Johnson said he took it. Joseph Newman Boyka took it. Cummings took it. Did I say normally took it? Whether here or there, I don't know. But Bernard took it. So that's what it is.
So imagine now. So the president has to take lead.
Mm-hmm.
As a leader of this country, you saw Biden, you saw the Prime Minister of Britain, all these people taking the
Can I take my take?
It is time.
It is time.
It is time
It
for the president to take lead, encourage the people to take vaccine. But it is the government that has to bring the vaccines in. Because the vaccine we got was not sufficient. They need to bring more. You're talking about a country of about 5 million, so not everybody, children will not take it, right? So people of setting
the government said it's making an arrangement to write the Senate for additional $2 million to deal with the vaccine availability. Let's take our second break. And when we come back, you call me on that number on 077777107. You'll be live from 5050 on Sky. One of the 7 hour special studio guest, University of Liberia Professor Thomas Kaydor.
Bring my umbrella so I can rush to the bank before the line gets long.
So the bank honor this ring. Let me laugh at you small, yeah. Yeah, big girls like me do banking from anywhere. All I need is a nice cup of coffee and a chair. It's time to start transferring some cash around.
Oh, you can transfer money from your bank account to your phone?
Simple. My account is connected to my wallet. Standing in line at banks is the least of my worry these days.
Orange Money Bank to Wallet is now with EcoBank. Transfer your money from the bank to your Orange Money wallet and vice versa. Register today with Orange Money Bank to Wallet and worry no more about standing in long queues at the bank. Now you can do your bank transfers from anywhere using your phone. Just dial *144# and follow instructions.
Brings you closer to what matters.
Orange.
Hey man, give me the answer now. What's the now president of Liberia Football Association?
Oh my brother, why you saying I'm gonna give me that for?
You asking me plenty question.
My dear, I'm a new level, yeah. The more you know, Orange, is the more you win.
Predict the exact score for each Euro Cup 2020 game and stand a chance to win recharge cards and cash prizes up to $50. Text your answer to 272. Each text is 10 cents.
Brings you closer to what matters.
Orange.
Papa, I just like you know for the president when I saw.
You complain, my biggie, you know your news?
When news again?
Get your Orange Home Internet bundle for only $39. That's 75 gigabytes of data for 30 whole days for only $39. Just dial *833# to activate your Orange Home Internet bundle.
Brings you closer to what matters.
Orange.
Papa, I just like you know for the president when I saw.
You complain, my biggie, you know your news?
When news again?
Boost your data allowance with the new Euro 2020 Cup Data Bundle. Get 1 gigabyte for $1 only. Valid for 24 hours. Just dial *111#.
Brings you closer to what matters.
Orange.
Hello, your number one 100% Liberian-owned professional garage and auto parts dealer, Uptown Garage, is still around and going stronger and getting better. Yes, Uptown Garage at the intersection of Broad and Nelson Streets, after 20 years in the business, has a new spare parts store known as Uptown Spare Parts on Broad Street side. You don't have to order spare parts from overseas. You can purchase brand new spare parts for your car from us. No more used parts. For original spark plug from Japan, oil filters, engine oil, and everything you need to get your car working perfectly, come to us. Uptown Garage has a branch at Rehab that you can also count on. We have a diagnoser that can find and we fix any problem on your car. With our sophisticated equipment, we give 1 month warranty. We provide a tow truck free of charge if it's our garage that will work on your car, but we can tow your car anywhere for a fee. Uptown Garage has been around for 20 years now, providing reliable, efficient, and professional services and durable auto parts for your car. Contact Uptown Garage head office on 0777 553317, 0886 553317, or at our rehab branch on 0770 902865. Our email address is uptowngarage2014@gmail.com. Uptown Garage, always the best. Forget the rest.
Bring my umbrella so I can rush to the bank before the line gets long.
So the bank? Honor this ring? Let me laugh at you small, yeah? Yeah. Big girls like me do banking from anywhere. All I need is a nice cup of coffee and a chair. It's time to start transferring some cash around.
You can transfer money from your bank account to your phone?
Simple. My account is connected to my wallet. Standing in line at banks is the least of my worry these days.
Orange Money Bank to Wallet is now with EcoBank. Transfer your money from the bank to your Orange Money wallet and vice versa. Register today with Orange Money Bank to Wallet and worry no more about standing in long queues at the bank. Now you can do your bank transfers from anywhere using your phone. Just dial *144# and follow instructions.
Brings you closer to what matters.
Orange.
Thank you very much. Back on 50/50 on Sky 107. What will you prefer? Our special studio guest is the Professor Thomas Kaydor. I told you earlier that we want to get some update as to the veracity and deadliness of Delta variant at level 4 placed by the CDC on Liberia. So nobody could give us that better information besides the deputy of the incident management system, Dr. Francis Kaydor. I'm going straight online to talk to Dr. Kaydor. Is now. I told you earlier, would get straight to Philip Wisse, who has been rumored that something funny that happened to him. So when we're waiting for Dr. Kaydor, I want us to go straight to Philip Wisse and talk to him so that you can hear from him. whether he's living or we are at the funeral of Philip Wisse's death. So I am going straight to the man I always call my Gina to talk to him. So I'm waiting for Philip. Good morning, Philip. Good morning. Good morning, Philip.
Hello?
Hello, Gina. Good morning.
Hello?
Hello, Philip. We say good morning.
Morning.
This is T-Max. We are live on the radio.
T-Max, how are you?
I'm all right, Gina. I'm happy to hear from you today because the news we're hearing yesterday.
We thank God.
You thank God. Everything.
Thank God. Thank God.
Thank God. So, am I talking to a ghost? Are you alive or you are dead? I'm talking to a ghost.
The funny thing I ever heard. They can't talk. I'm still alive.
That the former vice president of Liberia, Joseph Nyimabweka, called me this morning. He was in tears. He called me to find out whether you were still alive because he heard that you had died. I told him.
Thank God.
Go ahead.
So how are you?
Well, my man, we are here. The radio station is all right, and everybody is missing you. We want the Gina back. And so I'm happy that I'm talking to the Gina. I'm not talking to the spirit of the Gina. I'm talking to the living Gina. Dead can't talk, Gina.
Before you start running for me.
Yeah, we are experiencing this COVID thing. A lot of people that are dying.
How the city?
The city is all right, Gina. The city is all right. Okay, Gina, thank you. Thanks for hearing from you. And we're praying for you. By the mercy of God, you'll be back to us. Thank you very much, Gina. That was Philip Wissett. I just talked to him straight from Accra. That we heard the news that he had passed. The vice president of Liberia, the former vice president called me. Ellis Cummings also called me last night and this morning to inquire whether Gina was still alive. Indeed, Gina is still alive and kicking. Now, for expert opinion, let me go to the line to talk to Dr. Francis. Good morning, Doc.
Good morning. How are you doing?
I'm all right. Should I pack my things and run away and go back to Grand Crew?
You can stay as long as we all continue to do.
Bring me up to date as to the status of where we are. Are we out of the woods? Or we
T-Max, the thing about infectious disease is that prior to taking the different, implementing the various protocols and so forth, there were people infected. When you are dealing with a disease, the disease does not listen. It continues to do what it can to survive. So while we were sitting there trying to write strategy and proffer protocols and so forth, people were still being infected. And so we are going to see the infection rate going on, going up, as I indicated when I was with you the other day, looking at the reproductive number. So as it stands, this is what we are seeing until we get to a place where it's going to plateau. So within the next 2 weeks, we will determine whether we have reached our maximum apex. And if we reach the apex, then we see a plateau, and then from that plateau, we begin to come down. And so this is what we are looking at. So we are looking at the data, crunching the data, and coming up with some other things. So as it stands, today we have a positive case, 193 new positive cases, 193. That brings our cumulative to 4,098. 4,098. And so in this week alone, just this week alone, today is Wednesday and the week started on Sunday, we have 362 positive cases in the country. So quickly to the treatment unit, we have 65 persons now admitted at the treatment unit as of this morning, 8:30 this morning. Of the 65, 49 of them are oxygen dependent. So 49 are basically severe and they are dependent on oxygen for survival. Yesterday, we had 8 persons recover from the treatment unit, and unfortunately, we lost 1 person at the treatment unit yesterday.
So let me take you back. I like the numbers. The numbers are numbers of survival. I'm afraid and I'm concerned. How many Liberian lives have we lost since this Delta variant?
So I can go back to crunch the data again and tell you exactly. But yes, on Sunday when we did the analysis of the month of June, we just lost about 33 persons within the month of June. So as of Sunday, so basically we can go back and crunch the data. The thing here is that there are people that have died. We have gotten samples. So until the samples result comes out, is difficult to say exactly how many persons. We also know that there are people dying in the community, and there may be burials where people were not tested. But those information that I'm going to give are those that have been tested and confirmed other deaths that are occurring.
So tell me that, because I was reading something from your boss, the Minister of Health, and let me read it to you. Tell me, as if you were sitting before Jesus Christ, or you were sitting before Musa Dean, or you were looking in the eyeballs of President George Manawia. She said, no need for lockdown yet. Health Minister assures the Senate, even though the numbers keep going up. How many Liberians must die? In the language of your plateau, how many numbers constitute a plateau that must die before we come to the conclusion of a total lockdown?
So, T-Max, I also have to flip the question to you. If you had to do a lockdown, what do you anticipate to get out of the lockdown? The point is, like I said, when you look at the arrow knot, that is a reproductive number. As long as people do not follow the protocol, as long as people that are sick are not going to the right place to get tested and so forth, definitely the reproductive number is going to increase. That is not something that any system can control. Even in the great United States, you realize that there were thousands of people that died. But the easiest way to stop the arrow not to become arrow 0 is that when someone is infected, they protect themselves, they wear masks, and they isolate themselves. The sooner they do that, the better it is. The next thing is that, yes, go ahead.
Do we have spaces in the hospital? Do we have oxygen in the hospital? Because when you were on the platform the other day, you were getting an SOS call of people procuring oxygen tanks and ventilators to come to the aid of the hospital. Are our hospital up to par to deal with this variant?
We cannot have a hospital. So when you plot in your map, you look at others. So if you look at developed countries, the same situation, there is no way you can meet the maximum requirement for whatever, because you are looking at a
Do we have spaces? Do we have spaces in the hospital?
There may be patients in the hospital that may have signs and symptoms of COVID, but the best place to be is the treatment unit. And this is the number that I have just given to you. Those that have gone to the treatment unit. We are working with the various hospitals where they have to isolate people that show signs and symptoms, that is respiratory distress, isolate them and provide the necessary oxygen. There will always be a gap in terms of the oxygen concentration. There will be gap in terms of oxygen tanks. There will be gap in the regulators that is attached to the concentrator. It is important that whatever contribution we can get. We are not only looking at Monrovia, we are looking at the entire country. As it stands, of the counties that we have, 12 counties are in response. And therefore, there's a need to send additional oxygen and other things to the other counties.
I don't want you to be political correct with me. Have we not reached the time? Because according to what the minister said in the which I think is the conclusion from the hospitals, churches are barred from having funerals. Funerals must be conducted at funeral homes. Doesn't that give us an inkling that we're getting down the clays?
You know, the thing here is that we are looking at the data. We all have to understand our cultural practices and look at the context under which we operate. So, T-Max, yes, we all may sensationalize the entire thing of a shutdown. But if we do a lockdown, what do we anticipate? Every one of us, what do we anticipate to get?
Why did we lock down in levels 1 and levels 2? Why did we lock down? Why did we impose curfew? Why did we declare a state of emergency then?
Because let me give you, and this is, I'm glad you asked this question. When we look at COVID, COVID was a new disease. We were all learning the implication of this disease. So we're all in the learning phase. So everyone went into a knee-jerk reaction. And based on that knee-jerk reaction, we had to take certain steps in order to make sure that we protect the general public. But we all know exactly what we all can do to stop the transmission of the disease. And that is wear masks, hand washing, social distancing. Even in spite of the protocols that have been proffered, people stay at nightclubs up to wee hour. There is no way, we can, as a health system, to police everyone.
So that we can
have.
If
we cannot do that.
If the guy cannot go to the next, if we cannot go to the nightclub and stay as long as we want to stay, then we are not out of the woods. What do you make of the United States' latest travelers advisory?
We can never, excuse me, sir. We have never been out of the woods. From day one, we have indicated we're still in response. And this is why I indicated that for the past, at the time I was there with you, 464 or 65 days, every day we sat down looking at the data. So we have never said we are out of the woods. No one has been out of the woods, and the country will never be out of the woods as long as globally there is still a case in a particular country.
So we're not out of the woods. We are not locking down because there is no medical evidence that if we have a total lockdown, that would have created a penalty for dealing with it. Before we come to that conclusion, that's my question to you.
And the question here is also to you, T-Max. How many times you, T-Max, will inform the Liberian people to follow the necessary protocol to stop of the virus?
I do it every day. I do that every day. I do that every day. Even though I don't get paid for that, I consider that as my social responsibility to do that. But the people must be told the hard truth so that we learn from the hard truth. This thing is
but the hard T-Max, this is the hard truth we are talking about. So even let's take, for instance, if we were to lock down, let me play the devil advocate. If we were to lock down, where will people be? Everybody will be conglomerated in their community. They will be sitting down at home. If they sit down at home, who police them in their home in order to wear their mask, to wash their hands and so forth?
If we don't lock down, if we don't lock down, we go out to the community, we go to another community, we spread the infection. So where's the way out?
But if you wear your mask, T-Max, if you wear your mask, if you wash your hands, the probability of you transmitting from community to community decreases. And so this is the simple thing we all need to do. And the sooner we do that, the better it is for every one of us.
What do you make of the latest American travel advisory to Liberia?
That is a travel advisory that is sent to other countries. So this is not only in Liberia. There are so many countries that are having a third wave. And because of that, the alert is to individual that before you go to a particular country that has an escalation in their numbers, you have to be vaccinated. If you're not vaccinated,
oh God, my
so the alert is done. The alert is done internationally to protect people from going to countries where you have an infectiousness of the disease.
I gotta let you go because you are such a basic person. I was saying this morning with the professor that there are three major things I think Liberia needs to concentrate on and make sure we enforce that. This compulsory vaccination, people must be vaccinated, fully vaccinated. If they are partially vaccinated, they gotta go for the last dose. Two, wear the mask I'm wearing until I go to bed, until I'm in my car, and keep the social distance. I don't know. You didn't tell me this when you were here. What is it that we reduce from 6 feet to 3 feet?
The thing here is that when you wear your mask, and I wear mask, the probability of using an aerosol, which is this particle of droplets of infecting other diseases. So this is the situation, T-Max. So what we are doing is we are looking at everyone is enforcing the mask wearing, and as long as it doesn't matter the distance from one person to the other. The distance doesn't matter. As long as you are protected, I'm protected. It is good by wearing our mask.
Do we have enough vaccines in the country or not?
We are anticipating vaccine by the end of this week or early next week. We are anticipating about 96,000 dosages coming to the country. We're also working with the AU to send us additional vaccine. We're also working with EU to send additional vaccine. So hopefully by the second week in July, we should have enough vaccine to cover as many people as possible.
You are a scientist, not a politician, but let me ask you a political question. And please, I beg you understand with me. When Donald Trump was president of the United States, Americans lost up to 500,000 of 500,000 Americans. Because he said nobody was wearing masks, nobody should wear masks. He even refused to wear masks by the time he got infected. My thing with you, how do we in our people now in the effectiveness of the vaccine politically? How do we do it? Do we let political actors, which have some of whom have already done that, Joseph Weicker, Ellis Cummings, Ellen Johnson Sirleaf, you two and your minister, does it have to be the president to inspire confidence in the effectiveness of the vaccine? And if your answer is a resounding yes, as the president, in your knowledge, because you would know, has the president taken his vaccine? Have I lost him? Hello, Doug, are you hearing me? The internet's frozen. I'm looking at him. I think I'm not getting him. So Dr. Francis Kepper, I wanted to get. So that's what we are.
So you see what he's talking about. And so, for instance, you got students in the classroom, you're not supposed to cause noise. But the students are still causing noise, right? So you have to discipline. You have to discipline. People are not supposed to spy for exams. Time, you take an exam, then you spy. But people do it. So in this case, and for me, I'm a social scientist. So behavior is something you can't change it one day. People culture, you can't change it one day. That is why these restrictions come. He was talking about the US. There were lockdowns in the US. Today, there are lockdowns in Australia. Because human being is just difficult to control.
And
he confirmed
I don't agree with him when he said that this United States, America travel is for everybody. That's not true.
No.
They didn't say that anybody going to England.
No, they didn't say
you can't go to England. You can't go to France. You can't go to Italy. You can't go to Germany.
Our president is in France.
Our president is in France.
So it's not for everybody. So the point is, the numbers he's talking about, they're good. And one point he struck, which is also good, is that they are not really accounting for all the deaths, the causes of all the deaths, because people are dying in communities and they're not being tested. They don't test some of the bodies, right? And that is why you need a comprehensive approach. For me, what you need now is, if the hospitals have They say it might have some spaces. You need to now set up treatment units. For instance, we got the football places here, Tima. If we want to comprehensively address the situation, you tell people we have to.
We pay things.
We have to increase testing. Testing this virus. So people come in and they're tested, right? You want to go and get tested so you will know your status. If anybody gets sick, they come quickly, you're tested. Right now, the testing, T-Max, when you ask anybody now, the people who are traveling and doing the testing, it takes 3 to 4 days to get results. At that level, we are not moving. You should be able to bring in...
Take your test today, get a test today, get a result today.
In hours. There are machines, machines in the States and all around the world. So it is the government that has to use international cooperation now to see how best they can get this thing bilaterally or on a multilateral arrangements. That's one thing.
Thank you very much. So, do we have another call on the line? Let's call us on that number on 0777 107. You'll be live from 50/50 on Sky. One of 7 special studio guests is Thomas Kaydor, professor at the University of Liberia. What would you prefer? Let's go to the line. Talk to our caller. Good morning. Good morning. We don't have a caller here. Can I take my break? I should not take my break yet. And they say the producer saying I should wait. You know, I'm being controlled by producers. When they say talk, you talk. When they say don't talk, you don't talk. They say now I can go back to the lines to talk to my first caller. Good morning. Oh, Darokeda is back. Goodbye. Thank you, Darokeda. You back?
Yes, sir. Because I didn't want to. Can you hear me?
I can hear you loud and clear. Go ahead, Doc.
Okay. I did not want to leave and speculation continue on and so forth. Again, so this question was asked, and I'm saying the same thing. The disease though is not selective. And so I think, in my good judgment, nobody is excluded from this vaccine. Nobody is excluded from the disease and so forth. So it behooves everyone to take it. I've said that now there are being close to 80,000 plus persons that have taken the vaccine. It falls within the purview of an individual to come out and say, I took the vaccine and this and so forth. So please, I think all of us do what is best. Science has proven that when you take the vaccine, you are protected to a certain level. I have taken the vaccine 4 doses, and I'm not crawling. I'm not sitting down. I'm walking, I'm moving. And so please, I encourage all Liberians, as the chief medical officer of this country, that the vaccine has been saved and let us continue to take it. And this is the only way we can protect our country. It was the vaccine that is saved. It was usage of the vaccine that is saving America and other countries. In the absence of that, Biden and everyone would have still had the same situation. Over.
Should we make it mandatory?
No country is making it mandatory. You cannot mandate. This is a life-saving mechanism, so we cannot make it mandatory. When you make it mandatory, everyone has a right. You are infringing on the rights of others. It is also through a persuasive method, educating people, talking to them of the safety of this vaccine that will encourage them to take it, and not the matter of mandatory or not.
Before I let you go, based on the capacity of our health delivery system, are we up to this task?
We are doing the best we can based on the resources that we have and so forth. And therefore, the sooner the general public begins to follow the protocols, the better it is for every one of us. So yes, indeed, we are doing the best we can.
Thank you very much, Doctor. Talking to you, and I hope you save more lives. I don't think that we should reach to that plateau, get to that decision of an imminent danger.
Sure, a plateau is just simply where the number reaches, and now it cannot go up. So as it stands, we keep seeing it going higher, but we know in a very short possible time, we will be able to break the curve.
Break the curve. Thank you very much, Dr. Kaydor. Now we can open the lines to you. Call me on that number on 0 3%. Whoa, my time is gone. Can I take my last break, or should I take calls? We just might have it the whole day. Let's go to the line. Talk to our first caller. Good morning. Good morning. The caller is not ready here. Can I take? Good morning.
Good morning. Good morning, Tima.
Good morning, my brother. What's your name and where you calling me from?
I'm Anthony Weller and I call from Bonus Farm.
Go ahead, Tony.
Yeah, Tima, thank you for the show and we appreciate your level of awareness you are carrying on. But one thing I noticed is that the vaccine is not in country. Even those who took the first dose of the vaccine, when we go for the second dose, the vaccine is not available. So one more about people who are not taking the vaccine, you think it'll be available for them to get? So I think all of the things government is doing is to push harder to get vaccines of the country in order to have all the citizens being fully vaccinated. Because even those all who are willing to take the vaccine, who took the first dose of the vaccine based on our experience and stuff, we're not able to get our second dose. As a nation of people. So I think we need to put politics aside and forget about the street lyrics.
You went for your second dose and it wasn't available?
Yes, they turned that down. They said there's no vaccine.
Where did you go?
I took my vaccine at the coconut plantation. And the second dose is yet to be available.
When was that?
This gone Sunday the 27th was the next appointment day. We went there. All of us that went over there, they said there was no vaccine. They turned us down. So I'm saying this for a clear alliance that if this government is listening to the reality of the day, let them see reason how they can procure the vaccine and distribute the various centers who are already conducting the first dose on people or citizens of this country so that they can be able to be fully vaccinated.
Thank you very much. Call me on that number on 07777 You'll be live. The time interval is different now. Let's go back to line 6. Talk to our next caller. Good morning.
Good morning.
Good morning, my brother. Is that Kimia, right?
Yes, T-Max. Thank you, sir.
Go ahead, Kimia.
Yeah, the studio guys here has elaborated much, but what I won't disagree with him is the total lockdown. Economically, if you have a total lockdown, then many of us who are hungry for going to find food daily, we may die out of starvation. I think the government should lobby around with our partners to bring in more drugs in the various hospitals. COVID may not be a specific case. Maybe I have some symptoms, maybe I have regular headache, and maybe my stomach is running. My system could be locked down. If we have drugs in the various 15 county hospitals, I think we have a fight against other ailments. I think it's about a fight against COVID. I think that's the way that government should do. We will write the way to the vaccine. Government too should take the political will, like what it did in America. I think we have a way to champion this and win a battle, like how they did in Ebola. It could be done right now. But total lockdown is not needed because government is having a responsibility to citizens. That's the argument.
Thank you very much. Call me on that number on 07777 You'll be live from 5015 on Sky. One of the seminar special studio guest is Professor Thomas Kaydor of the University of Liberia. Let's go back to the line to talk to our next caller. Good morning.
Good morning, T-Max, and good morning to the professor in studio, Professor Kaydor.
You didn't give me your name, please. What's your name, please?
Jonathan Taya Dolake.
Oh, okay, Dolake, good morning. Go ahead.
And I'm so glad to have heard from Gina and from Accra.
Yeah, Gina is all right. We thank God for that.
Yes, quickly, T-Max. I hear a lot of people on the left quadrant that when you talk about lockdown, is that you're talking down to the people who don't have, the underprivileged. And when you talk about no lockdown, like you're talking in favor of them. The reality here is that governance, what we cry for throughout, is that governance should be a service-oriented base. You should understand that there will be tough times and there will be good times. And that is what we ask for: quality, audit, and performance of governments, so that it serves as a reliance. Where we are today, the reason we're not going to lock down with the Indian virus, unlike the first COVID, because we did not perform properly with the 25 million and the stimulus package. That is square reality. Scientists will not want to talk.
So we are afraid. So we are afraid that
the matter is that this variant is deader than the previous. So we have to take every precautionary measure. If somebody said we sit home, when we get it from among people who are into our because we're not wearing masks, according to the chief medical officer, but were we to go out, we will be interacting with more people, and the frequency of people will be interacting with different levels and will be more harmful to us. We understand we don't have it all to do to cater to our people, but that is why we have to get ourselves geared up. When there are good times, get ready for bad times.
Thank you very much.
Now,
Thank you very
bad time
much.
has come, now we have to deal with it drastically as much as possible.
Thank you very much. Call me on that number on 0777. Let's take our last break. When we come back, we go straight to Princeton in Studio A to give us comment from our social media users.
Bring my umbrella so I can rush to the bank before the line gets long.
So the bank? Honor this ring? Let me laugh at you small, yeah? Yeah, big girls like me do banking from anywhere. All I need is a nice cup of coffee and a chair. It's time to start transferring some cash around.
Oh, you can transfer money from your bank account to your phone?
Simple. My account is connected to my wallet. Standing in line at banks is the least of my worry these days.
Orange Money Bank to Wallet is now with EcoBank. Transfer your money from the bank to your Orange Money wallet and vice versa. Register today with Orange Money Bank to Wallet and worry no more about standing in long queues at the bank. Now you can do your bank transfers from anywhere using your phone. Just dial *144# and follow instructions.
Brings you closer to what matters. Orange.
Hey man, give me the answer now. What's the now president of Liberia Football Association?
Oh my brother, why you say I'm gonna give me that for? You asking me play that question?
But yeah, I'm a new level, yeah. The more you know, Orange, it's the more you win.
Predict the exact score for each Euro Cup 2020 game and stand a chance to win recharge cards and cash prizes up to $50. Text your answer to 272. Each text is 10 cents.
Brings you closer to what matters. Orange.
Papa, I just like you know for the president when I saw.
Oh, play my biggie, you know you're the news?
What news again?
Get your Orange Home Internet bundle for only $39. That's 75 gigabytes of data for 30 whole days for only $39. Just dial *833# to activate your Orange Home Internet bundle.
Brings you closer to what matters. Orange.
Papa, I just like you know for the president when I saw.
You all play my biggie, you know you're the news?
What news again?
Boost your data allowance with the new Euro 2020 Cup Data Bundle. Get 1 gigabyte for $1 only. Valid for 24 hours. Just dial *111#.
Brings you closer to what matters. Orange.
Hello, your number one 100% Liberian-owned professional garage and auto parts dealer, Uptown Garage, is still around and going stronger and getting better. Yes, Uptown Garage at the intersection of Broad and Nelson Streets, after 20 years in the business, has a new spare parts store known as Uptown Spare Parts on Broad Street side. You don't have to order spare parts from overseas. You can purchase brand new spare parts for your car from us. No more used parts. For original spark plug from Japan, oil filters, engine oil, everything you need to get your car working perfectly, come to us. Uptown Garage has a branch at Rehab that you can also count on. We have a diagnoser that can find and we fix any problem on your car. With our sophisticated equipment, we give 1 month warranty. We provide a tow truck free of charge if it's our garage that will work on your car, but we can tow your car anywhere for a fee. Uptown Garage has been around for 20 years now, providing reliable, efficient, and professional services and durable auto parts for your car. Contact Uptown Garage head office on 0777 553317, 0886 553317, or at our rehab branch on 0770 902865. Our email address is uptowngarage2014@gmail.com. Uptown Garage, always the best. Forget the rest.
Thank you very much. You're back on 50/50 on Sky 107. I'm very sorry we cannot read the comments because we're running out of time. So instead, I'm reading the editorial with the caption, "It's time to roll up our sleeves in quote, Liberia is on the brink of a disaster. On June 26, the National Public Health Institute of Liberia, NPHIL, announced 101 new cases of COVID-19, 7 new deaths with no recoveries. The day before, 106 cases were recorded, while 2 days earlier, 155 cases were booked. It is a sad reality of the escalating number of COVID-19 related cases in Liberia. Liberia is now experiencing the third wave of the pandemic with the discovery of a new deadly variant, the Delta variant. Delta, formerly known as B.1.617.2, is believed to be most transmissible variant yet, spreading more easily than both the original strain of the virus and the Alpha variant first identified in Great Britain. Public health officials there have said that Delta could be 50% more contagious than Alpha, though precise estimates of its infectiousness vary. Other evidence suggests that the variant may be able to partially evade antibodies, may be the body after a coronavirus infection or vaccination. And the variant may also render certain monoclonal antibody treatment less effective, the CDC notes. Delta may also cause more severe illness. A recent Scottish study, for instance, found that people infected by Delta variant were roughly twice as likely to be hospitalized than those affected with Alpha. The infection rate began to go high. Just this June, and unfortunately, major hospitals and even community clinics had already the alarming lack of beds for incoming patients. If this situation does not scare us, why else will? This is why it is now the responsibility of every single Liberian to help fight the deadly epidemic by adhering to health protocols announced by the Ministry of Health and Social Welfare. We must ensure the mandatory wearing, and that Dr. Kaydor didn't buy this. When I say mandatory, he didn't buy it, but this is what is contained in the editorial. We must ensure the mandatory wearing of masks at all times in public places, ensure social distancing of a minimum of 3 feet from each other, and hand washing with soap or sanitizer. All persons tested positive for COVID-19 and their contacts must comply with health authorities and related health rules, such as keeping phone lines open, self-quarantine, submission of quarantine or observation measures, and adherence to medical advice. Large gathering of more than 20 persons, including parties, weddings, regular wakes, funerals, should be completely prohibited. If we haven't learned anything about Ebola, at least we've learned how denial and myths can be devastating during times, epidemics, and pandemics. This is why we must not take the COVID-19 vaccination for granted. COVID-19 vaccines were developed using science that has been around for decades. COVID-19 vaccines are not experimental. They went through the required stages of clinical trials. Extensive testing and monitoring have shown that these vaccines are safe and effective. COVID-19 vaccines are effective. They can keep you from getting and spreading the virus that causes COVID-19. COVID-19 vaccine can also help you from getting seriously ill, even if you do get COVID-19. Getting vaccinated yourself may also protect people around you, particularly people at increased risks for severe illness from COVID-19. Get vaccinated regardless of whether you already have COVID-19. Studies have shown that vaccination provides a strong boost in protection in people who have recovered from COVID-19. That's the end of the editorial today's edition of the Front Page newspaper from the caption, "It's time to roll off our sleeves and fight COVID-19, Liberia on the brink of a disaster." Well, thank you very much, Doc. Should I call you Doc? I haven't reached to that level yet. Professor, I know you'll get there.
Yeah, I'm in school. I will be there.
Mhm.
I expect to get my PhD maybe 2023.
After the election.
No, before.
Before the election.
Yeah, I'm honored now.
Thank you, Doc.
Thank you,
Professor.
Thank you to your brother. And let me say this. What is happening now is that those of us who have taken the vaccine, the reason we've taken the vaccine is to immune our system, right? At certain level. So vaccine is not the cure for COVID.
No.
Meaning that so what we need to put first to these health officials is that they need to improve and enhance testing. Because in fact, some people who might go for vaccine might be carrying the virus without knowing.
Thank you very much. Our time is run out. Thank you very much. We hope to see you next time. Our time is up and the news is wrecking on my door. Very much. I will see you again.
Thank you to Max.
Wash your hands. Get vaccinated.
Yeah, and distance yourself.
Distance yourself.
And testing has to improve.
Thank you very much. And I know we come to the end of this edition of 50/50. My name is T-Mac. Here tomorrow morning again for another discussion. Bye-bye for now.